Hi, I'm Jennifer Jackson. I'm a registered nurse and an assistant professor in the Faculty of Nursing at the University of Calgary. And this is a conference presentation that I presented at the European Society of Intensive Care Medicine. And I just wanted to record a quick video to share the content this way as well for anybody who wasn't able to attend that session. So I was asked to share some insights on recovery, like how do we return to a new normal, and our challenges coming out of surge in COVID-19, and what the impact of everything has been on intensive care, and kind of how we can move forward with that. So one thing to say with COVID-19, it may be for very few people the Spanish flu pandemic in 1918 to kind of 1920, that may still be in living memory for some people, but for most of us, that is not something we have any concept of. And so I think it's important to say in our globalized world, like, this isn't a place we have been before. This is new for everyone. And we can draw on a lot of evidence-based strategies, but at the same time, it isn't a place that we've been before. So we need to be gentle with ourselves and with our colleagues, because we're all trying to figure this out together, and we might not always get it right all the time. It's also important to consider that what constitutes recovery is something we can create, not something that's going to happen by osmosis. So we can think about, like, what do we want recovery to look like, and then what path might we take to get there. So just to say, we need to make sure that we're in recovery, and anybody in the intensive care world is very familiar with these ideas. But just to say that we may need to continue lockdown off and on for brief periods. We're seeing that in different countries. We need universal use of masks and techniques to prevent new surges in cases, at least until we either have highly reliable treatment or a vaccine available. And we can all continue to advocate for public health, even if that just means leading by example and, wearing a mask and sanitizing our hands. So while many people are clinicians and they're working directly in the hospital, there's still lots of other ways we can have an impact beyond the ward where we are working. So when we think about recovery, for anybody who has chronic illness or has, experienced a major accident or something, or even just mental health difficulties in your life, you'll know that recovery is not a straightforward linear process. It's something that takes time. And we all need to recover, like, broadly as our societies, and not only individuals. So the need is very great. This is something that I think it's important to just reflect on and manage our expectations, that this isn't going to happen really quickly, and we need to be patient with ourselves, just as we would be patient with someone that we were working with who was in a process of recovery as well. And also to say, if we have days that don't go so well, or we try and adapt a strategy and it doesn't go so well, like, we're building this knowledge as we go, and we'll have to be really supportive with each other. So thinking about how we manage recovery, some of the new research that we have that is under review right now, hasn't been published, but hopefully soon, shows that almost double the number of nurses are very concerned about their mental health as the number that are very concerned about their access to PPE. So mental health for nurses is a major concern, and while I don't have evidence for other healthcare professionals, I think it's fair to say that that probably applies more broadly. One of the most important things we need to do is have awareness of how we have been affected by the pandemic. And so awareness is the factor, from some research I've done on resilience, awareness is the factor that allows us to take action. So if you've ever seen someone who perhaps has had a breakup in a relationship and they say, oh, I'm completely fine, and you think to yourself, like, you're not fine. And I don't mean to make light of that, but like, I think many of us have been there. So if you have that attitude that like, no, I'm fine and I haven't been affected, it's going to impair your ability to make good choices that can support recovery. And that applies to our societies as well. If we say we just want to open all the businesses as fast as we possibly can, that's going to have a different outcome than if we say, can we take a collective moment and reflect on what the impact has been and how we want to move forward. Also within this awareness, it's fine, and in fact it's advantageous to recognize that it's normal to be upset, it's normal to have bad days, it's normal for this to be difficult. It's perhaps not normal if this is causing profound challenges for you, such as, you know, if you're resorting to drugs or alcohol to cope, or you're just feeling completely numb all the time. There are lots of mental health professionals who are available, and I would definitely recommend seeking out professional supports as needed. Those services are there for a reason, and they're evidence-based, and so using them to manage these challenges is completely acceptable, and in fact, highly recommended. So when we think about recovery, what sort of evidence-based techniques could we draw upon? One of the most important things we can do is talk to other people about our experiences. Don't keep everything bottled up inside. Have an opportunity to talk to others. So this can include formal debriefing, but it can also include like at a safety huddle or at a chat at the desk. You can just take a couple of minutes to make some space for people to say, like, how is everyone doing? Talk to the person who's next to you, or, you know, do we need to have something a bit more structured? Handover is another time where you can implement some debriefing. And for example, if you've ever done handover and said, you know, oh, I took my patient to CT today, and then we came back, found out they had free air in their abdomen, and took them to the OR. Versus something like, oh my gosh, I had the most stressful day of my life. I had to take this patient to CT, and they were thrashing all over the place, and the sedation wasn't adequate, and we couldn't find a doctor to get more orders. And perhaps you see the difference between those two things. When you're giving a handover, you can convey the clinical information, but there's also a chance there to debrief a little bit and talk about your experiences. And so this is a way, if you hear someone doing this, it's an opportunity to just listen and respond with empathy and say, that does sound really hard, and just acknowledge that those experiences are difficult. And this is a really important opportunity for colleagues to support each other, because there may be feelings of like, well, I don't feel like anybody else understands, or you know, my family, my partner, they just don't get it. So if you're working with other people clinically in the hospital who have kind of seen what you've seen, maybe there's a chance there that you can support each other. So before people go home, say, is everybody okay? Does anyone want to talk to for a few minutes? Because looking after ourselves is just as important as looking after our patients. You have to put on your own oxygen mask before assisting others, as that common plain announcement goes. Another thing is to make sure everyone's involved. The people who are cleaning our wards, they probably need to debrief too. The people who are clerks or porters, they probably need to debrief too. So give everyone an opportunity to have chances to discuss things. Some early evidence coming out from China, one of the hospitals there had 24-hour psychological support available, and they said that that was integral to their infection control strategy. So this isn't just sort of like a nice to have type of thing. This directly impacts the ability of clinicians to provide safe care and manage infection control. So we need to, as nurse leaders, hospital leaders, we need to make sure that we're providing psychological support to the fullest of our capacity, whatever that might look like. If you have a lull or a decrease in cases, especially for managers, I've organized time so people can be away. Use the chance to get away from work wherever you can. So if you can have an opportunity to take, over the summer or perhaps over other holidays, if the care in the ward is manageable and people can take a week off or even take 2 or 3 consecutive days off, please organize that they can do that. I would not get too caught up on, how many hours of vacation time or have you got allotted or those kinds of things. Like, just give people breaks. The evidence shows that recovery is better and faster when people have consecutive days off. So wherever possible, try and arrange, even if it's 2, 3 consecutive days off, and make sure everybody in your team has an opportunity for that. Also, help each other have breaks during shifts. Some people have expressed to me, it's absolutely bananas at work and we're not getting breaks. And I recognize that is an extremely challenging situation, and I'm not trying to make light of that. But at the same time, a break is a safety intervention. It gives someone a moment to hydrate, use the restroom, and also have an opportunity to eat something. They can collect their thoughts, take a deep breath, and come back. And if you have even 5, maybe 10 minutes to do that, you're going to provide safer care and have fewer errors than if you don't. So ideally, that's something that's structured and supported. But I tell the students I work with, at the bare minimum, take the power you have and use it. So go to the nurse working next to you and say, look, I will cover your patients for 10 minutes if you want to go get a coffee. And then when you come back, you cover my patients for 10 minutes. And I mean, unless people are actively arresting, you can almost always eke out even 5 minutes, 10 minutes. And so if working with your buddy next to you, if that's all you can do, that is still worth doing. Or, pass the pager to someone else and say, I need 10 minutes, I will be back, and then you can have 10 minutes. There's evidence to show that offering someone a quick coffee break increases morale, even if that other person doesn't take the coffee break. Just the act of offering can show, like, we're in it together, we are a team, I'm here to support you. And so even something that simple, or, can you go get a coffee? I'll give you $5, you get me one as well, and then we can both have them while we're here. Whatever you can do to have a small break during your shift, and also longer breaks for recovery. These are all evidence-based strategies that are going to support you and help you provide safer patient care. So also do good things for yourself and others. So don't underestimate the importance of taking time for yourself. I think many people, when they talk about self-care and they talk about resilience, this is a mainstay, and it is with good reason. I mean, it's not the only thing that we can do, but it is very important. So don't underestimate the chance to do something good for yourself. I mean, even if you're inside, have a picnic on the floor, rather than at the table, and light a candle and have some wine, or whatever it is that you can offer yourself something a little bit special. Like, that is an evidence-based intervention. Also, try and think of things that help you feel good rather than things that are kind of numbing. So, maybe if you're watching something funny on Netflix, you love it, but if you're just watching Netflix and feeling dead inside for hours, maybe you need to try a different technique. So maybe it's more important to phone someone and say, can we just have a talk for an hour, because I'm really worn out and I just need some support. So seek out the supportive people in your life, whether it's Zoom calls, phone calls, texting, the people you live with, whatever the case may be. I know that these techniques do not remove the burden of everything we're experiencing, but this is if this is the best we can do, we can still do it. We can still do good things for ourselves, even if they can't get rid of the whole problem. So we can also reflect on the potential for post-traumatic growth. So there's evidence to suggest that after trauma, some people experience higher levels of functioning than they did beforehand. Now, this doesn't necessarily happen right away, but it is, I include it here just to give you a little hopeful note that things can be positive, and you can, research shows us you can achieve good outcomes even after being through traumatic experiences. We know that COVID-19 is awful to experience. It's awful for clinicians. It's awful being in lockdown, but it will end. And we don't know exactly what that might look like, but it maybe gives us an opportunity to say, how can we grow beyond this experience? I think, when we say get back to normal, I think COVID has shown us that our normal actually had a lot of holes in it, whether it's for people who are homeless or people who are in long-term care. Our normal was not functioning very well for wide portions of our population. So how can we make positive changes and recognize where those holes are and address them? Also, COVID-19 has shown us that we can move a lot faster than maybe we had thought. Like, government can be a lot more agile, and as can healthcare hospitals and healthcare organizations. Many countries set up field hospitals in a matter of weeks and days. And I think if we had proposed massive changes before COVID-19, we'd say, oh, that's not realistic, and you don't understand how the system works. But now I hope we can see that actually when we really need to, we can move really quickly and we can change how we work in a big hurry. So how can that be inspiration for us in the future? And what sort of changes can we hold on to, maybe in telehealth or in other kind of techniques that are actually going to be a lot better in the long run? This is a good chance for us to organize and say, how can we advocate for our professions? How can we advocate for adequate healthcare funding? And how can we have the structures that it takes to support ourselves? There's a balance to be had between, ideally, we would have great systems and staff wouldn't need to recover in the first place. At the same time, there's also the tension of we want to empower individuals that they are not powerless just because the system is struggling. So try and find things where you can do supportive and encouraging behaviors for yourself, and also see how you can connect with your colleagues and say, how can we make sure that this system is better? And so that, the next time there's another wave of cases, or the next time there's a critical incident of some kind, that we can make sure that we all have as much support in place as possible going forward. So there's no clear answers for these things. We have lots of challenges ahead of us, but I hope this provides some evidence-based strategies to consider, and perhaps if not things that are new to you, maybe just to draw your attention back to the value of looking after yourself and your team as we continue towards recovery. So my website's on the screen, and I welcome you to be in touch, and we can continue the conversation from there. Great, thank you very much.